Hello friends, welcome back to our YouTube channel. In today's video, I will be discussing about non-invasive ventilation that are CPAP and BiPAP. Okay, first what is non-invasive ventilation? Yes, the name says it is non-invasive ventilation. That means you are not going inside the trachea. You are giving oxygen via mask without the need for endotracheal intubation. Okay. Usually, patients on non-invasive ventilations are typically awake or alert and they are breathing spontaneously on their own. And indications for non-invasive ventilation. First one is acute or chronic respiratory acidosis. In conditions like COPD, a patient goes to exacerbation. That means a patient experiences hypoventilation means the CO2 will be accumulated in his lungs, right? So we have to eliminate excess CO2 in this patient. In this case, NIV such as BiPAP is best choice. And the second one is cardiogenic pulmonary edema. In this case, due to left ventricular failure, the fluid is accumulated within the lungs, right? Because of ineffective pumping of the heart. So, this results in shortness of breath and respiratory distress. In order to relieve the respiratory distress and reduce the workload on the heart, we can go with NIV, okay? Because the patient is conscious, right? And post-operative acute respiratory failure. In post-operative patients, in order to reduce the complications that are related to ventilation, we will go with NIV. Because in ventilator, there will be more complications like pneumonia. This is more serious, right? So, in order to reduce this pneumonia, we will go with NIV. And chest trauma patients, already patients with chest trauma are very stressed, and this mechanical ventilation will leads to more stress, and this will increase the risks that are associated with ventilation. So in order to reduce the risks, we can go with NIV. And obstructive sleep apnea patients, in this case, CPAP is treatment of choice for these patients because during sleep, in patients with obstructive sleep apnea, the muscles in the throat, like tongue and soft palate, will relax, which can narrow or close the airway. This will result in cessation of breathing. Okay, that cessation of breathing is known as apnea. In this case, a CPAP machine is used to keep the opening of airway during sleep by providing continuous stream of pressurized air through the mask. Okay, and contraindications for NIV. First one is facial trauma and burns. We all know that this NIV uses mask to deliver oxygen, right? So using mask will increase the discomfort in these patients. And second one is fixed upper airway obstruction. This NIV mask will give the oxygen through nose and upper airway and lower airway. If patient has upper airway obstruction means we can't able to achieve that much oxygenation. In this case, we can go with intubation instead of NIV. Okay, and active vomiting. We know that a mask is not fitted for patients on vomiting and respiratory or cardiac arrest. In this case, the patient is in unconscious state. Usually, this NIV is not indicated in patients who are unconscious. This is indicated in patients with conscious who is breathing on their own. Okay, and then NIV devices, which are CPAP, BiPAP. In BiPAP, we have spontaneous and spontaneous timed two modes. Okay, CPAP. CPAP is delivered using continuous flow of oxygen or pressure. Okay, and BiPAP, in BiPAP spontaneous mode, this mode is where machine augments the patient's spontaneous breath, which means there is no machine delivered breath. The machine will deliver breathe when the patient indicates breathing or triggers breathing. Okay, and in spontaneous timed mode, the ST mode, that means spontaneous time mode, includes backup rate that's slightly below the patient's respiratory rate. In this mode, the machine can deliver breathing when the patient breathing is slowed down or stops. This is the difference between spontaneous and spontaneous timed modes in BiPAP. Okay, in spontaneous, the machine will deliver breath when the patient triggers, but in spontaneous timed, the machine delivers breath when the patient is stopped or slowed down the breath also. Starting with CPAP, here CPAP stands for continuous positive airway pressure. The normal pressure we will set is 5 to 20 centimeter of water. Okay, here a constant and continuous pressure will be delivered to a patient during both inspiratory and expiratory phase. Okay, So this constant pressure will prevent the alveoli from collapse, so this helps in oxygenation. Constant pressure will maintain the patency of airway. Okay, generally this CPAP is recommended for obstructive sleep apnea patients because this will provide the pressurized airway that will help the opening of airway and prevent the collapse of airway during breathing. Okay, and this CPAP can be administered via mask such as nasal mask which covers the nose and full mask which covers the nose and mouth. Okay, and also nasal pillow. In this case, the tubes will fit into the nostrils. The memory trick is CPAP, right? It starts with C. So think of constant. Positive airway pressure provided at constant level continuously to prevent apneic episodes. Okay. Next, BiPAP. Here, BiPAP stands for Bilevel Positive Airway Pressure. Hence, it is named BiPAP. It has two types of pressure. One is IPAP and another one is EPAP. Here, IPAP stands for Inspiratory Positive Airway Pressure, whereas EPAP stands for Expiratory Positive Airway Pressure. In IPAP, the pressure will be very high during inspiration, which facilitates the entry of air into the lungs. Okay, and in EPAP, the pressure will be very low during expiration. So this help the patient to breathe out very easily. So in this case, the BiPAP can eliminate this accumulated CO2 from lungs. Okay. Usually, this IPAP is set at the value of 8 centimeter of water, whereas this EPAP is set at the value of 4 centimeter of water. And the important thing is the difference between IPAP and EPAP is known as pressure support. This should be at the rate of 4 centimeter of water. Okay. This pressure support helps in providing adequate tidal volume. Thus, it helps in ventilation. So, this BiPAP helps in both oxygenation and ventilation, whereas the CPAP helps only in oxygenation. And the memory trick is BiPAP. A name itself has bi. So think of bi level. Airflow is administered at two different levels. Here bi means two. Okay. One level is inhalation and another one level is exhalation. And the major difference between CPAP and BiPAP are the pressure support in CPAP is only on constant pressure for both inspiration and expiration, whereas in BiPAP there is two pressure, one for inhalation and another one for exhalation. And main function of the CPAP is keeps airway open and improves oxygenation, whereas this BiPAP helps in improving oxygenation and removal of CO2. Okay, and in CO2 removal, the CPAP is not effective, whereas this BiPAP is very effective in CO2 removal. And the CPAP is best for obstructive sleep apnea patients because the CPAP keeps airway open, right? So this will helps in reducing sleep apnea occurrence. And this BiPAP is best for COPD patients with CO2 retention because this BiPAP is helps in removal of CO2. And the CPAP is used in patients with type 1 respiratory failure where the oxygen is very low. And this BiPAP is used in patients with type 2 respiratory failure where there is low oxygen and high CO2. At last, complications of NIV. The most common complication is mask discomfort and skin rashes that are secondary to hypersensitivity or infection. These are most serious, okay? And rarely, nasal bridge ulcers may also happen and aerophageal xyluria may arise. And sometimes the most serious effects such as pneumothorax, pneumocephalus or pneumomediastinum may also occur, okay? Let's solve this MCQ. A 65-year man with a history of COPD admitted to the ICU for acute respiratory failure. ABG shows pH 7.28, oxygenation 55 and CO2 70. And he is on 2 liter of nasal oxygen. Which mechanical mode ventilation is most appropriate for this patient? Options are assisted control mode and another option is CMV mode and CPAP and BiPAP. Here the answer is BiPAP because we know that this BiPAP is helps in removal of excess carbon dioxide, right? So the patient in this patient, the patient's ABG shows the P partial The positive pressure of carbon dioxide is 70, which is very higher than the normal, and the oxygen also very low. This BiPAP is helps in providing oxygenation and removing excess CO2. So we can choose this mode for this patient. That's all about it. CPAP and BiPAP. If you like this video, share this video to your friends who are preparing for examinations. To download flashcards, join our WhatsApp group and the link is given in the description. To attend daily quiz, join our Telegram channel and the link is given in the description. And make sure to subscribe to our channel for more videos. Thank you guys.